What's up, class? For this week's video for Health Informatics, we'll be discussing electronic health records. Now, with the technology revolution, more and more data is starting to become recorded electronically. Now, with electronic health records, or EHRs, individual health information could be recorded online and shared among health providers to be much more efficient than recording data on paper. Now, this is super cool and beneficial to us as a society because time and money can be saved when recording and sharing data on an individual patient. And now an EHR can be super helpful and useful to us, but with the rise of an electronic record, there also comes risks and barriers to overcome. The main problem being privacy, data breaches, and a steep learning curve. Now with EHRs, patients would have to give consent to have their data shared. Even worse is if insurance companies were to get a hold of this electronic data, they could use it against the patients. Now, since the data is electronic and not on paper, hackers could data breach the database and view all the patient's information and even worse, share it. But of course, there are protections set up to prevent this. And lastly, not every worker in the informatics and health field are sufficient with technology. So there would be a steep learning curve, but with later generations being more intertwined with technology and programs that are being designed to be more user-friendly, this learning curve could be overcome. Overall, electronic health records are super crucial to our health field to become more progressive and ultimately more efficient.
One solution to some of the problems faced in healthcare is the use of electronic health records, also known as EHRs. An EHR is a collection of electronic health information taken over time about patients and can be shared across different healthcare settings through a network information system. EHRs can contain a wide range of the patient's data, including their medical history, allergies, immunization records, and billing information. Because it can contain so much information, it is important that EHRs are able to be stored over a long period of time and accessed across different healthcare settings. While the regulations may change over time, the typical preservation time of patient data ranges between 20 to 100 years. I think that this is a reasonable time range, especially since the average human life expectancy continues to increase. But even though the preservation time has not been decided yet, I still think that EHRs are a better alternative and more reliable than using paper records.
Several important pros to the electronic health record in healthcare. Most importantly, it is an efficient method to store the patient information. This is because various data can be stored in EHR and can be shared across different systems. The data not only includes all the medical histories of the patient, but also many other information such as allergies and billing information. Another pro to EHR is that the data format caters to the different medical specialties. This means that the data is presented in a way that is easily understandable by all types of users throughout the various healthcare settings. There are also cons to EHR. The main con is the privacy concerns rising from the data security. Security concerns are unavoidable when inputting sensitive data on computer systems. Another con is the cost barrier. Transitioning into the EHR software is costly in both time and money, and many providers do not find it beneficial. As of 2010, more than 90% of the hospitals do not have a fully integrated system due to its cost.
An example that involves the usage of the electronic health record in practice is CPOE, or Computerized Physician Order Entry. This streamlined process for prescribing medication to patients allows physicians to prescribe medication or communicate with hospital staff to make a patient's treatment more efficient, but it does come with the flaws. Due to potential computer error or alert fatigue, the error rate that comes to CPOE is quite high. 39% of harmful drug orders in 2015 were sent without notifications, and 13% were fatal when they were missed by CPOE. There are ways to remedy these problems, however. A more visually appealing user interface for CPOE may eliminate alert fatigue, and double-checking drug orders may prevent the need for a computer to confirm the order.
The article by Neil Purcell really highlights how, although many hospitals have implemented CPOE systems that are meant to reduce the rate of serious medication errors, many of these systems still fail to catch these mistakes at an unacceptable rate. CPOE systems are implemented differently for every hospital, as every hospital has its own unique drug formulary. This customization can potentially produce flaws in the CPOE. To ensure that all CPOE systems are safe and mostly error-free, I think that the CPOEs of every hospital should be tested and evaluated before being put in use. Leapfrog, an organization mentioned in the article, has actually created an effective evaluation tool for CPOEs. In a 2013 study, researchers at Brigham and Women's Hospital found that there was a 43% reduction in the rate of preventable adverse drug events for every 5% increase in Leapfrog scores. Once more and more hospitals begin to use the Leapfrog evaluation tool, I believe that the rate of medication errors from CPOEs will drop. But as of 2019, only about 65% of hospitals have fully met Leapfrog standards.